Hey folks, we're back. I'm your host BKP and we're at Circuit World here in Blue Ridge, Georgia. Beautiful Friday morning. I know what they just looked back and said, really, it's rained like 29 straight days. We're okay. Promise you we're okay. So we're going to call it a beautiful day no matter what. Ask the Doc. Now it's time for Ask the Doc with Dr. William Whaley, brought to you by Georgia Cancer Research Center, affiliated with Northside Hospital. Happy 2019. Good to have you back.
Now, you just gave me two intros.
Did I?
Yeah. One, I love to watch the rain, and we finished the year December 31st up 17 inches over average. We finished the year before 13 inches over average, and we're now 0.3 inches over average for the first 3 days. Now, why that's
you keep up with the rain?
I do keep up with the rain. I've talked about this before. So if you go back, you remember we had a bad drought.
Yes.
And people were having to dig their wells deeper and go back and do it again. So this, I think, probably is going to reestablish our water table. And people talk about global warming and they're sucking too much water out of the ground, and Dallas and Houston are going to go bad because there won't be any water. This is the kind of thing that makes me feel like God's protecting us and global warming isn't going to go away. And now, Jeremy, hey, there are not any televisions in here. Jeremy, you need to listen to me here.
Hey, Dr. Whaley's ordering some TVs. You better pay attention.
I'm talking to you now.
Sorry.
Are these were smart TVs that you sold, right?
Yes, sir.
Did you they got things where you can make sure children don't watch anything. Did you program where they can't watch Nancy Pelosi and have to watch football? Or did you leave the Nancy Pelosi chip still in there?
No, we took the chip out.
Chip is out.
No Nancy Pelosi chip. Okay, well, good. Then I don't
well,
feel so bad.
Dr. Whaley is ordering some more TVs. We noticed there's a lot of TVs.
I just didn't want them to have a Nancy Pelosi chip. As long as it's got the football chip, I'm fine.
Let's get to our question.
All right, we got to go to work here. And one more thing. You were talking about Nancy Pelosi and the new Congress. Now, you remember a couple of years ago, there was this great criticism of our Congress because the last World War II veteran had left.
Mm-hmm.
There were very few combat veterans. There were people who'd been in the service in Vietnam but had maybe been in supply, not the point of the spear. You saw that picture.
That would be Richard Blumenthal.
You saw that.
I'm sorry, I just had
That'd be John Kerry. You saw that picture yesterday of the three congressmen missing leg, arm, and eye. Now, I don't know anything about their politics, but there are three guys in Congress today who are at the tip of the spear, lost a leg, lost arms, lost two legs, lost both legs, didn't he? Both legs, lost an eye, lost an arm. So maybe we'll get a little more, I love this country and I gave part of my body to it. I'm grateful for that part of the new Congress.
I don't think there's ever a day that we shouldn't wake up and be hopeful. Live in reality, but be hopeful.
Yeah, all right. Well, anyway, I was happy to see that picture of those three guys. Okay.
All right.
You can read these questions. These are pretty easy. There's no big words. Go ahead.
Well, I don't know what he's trying to say. Anyhow, for those of you that are new to the show, sometimes I struggle with the 4 syllables. All right, and that's my goal for 2019, to get past that. It is true. Is it true? Is it true that my diet can directly affect my tumor's growth while I am trying to fight cancer?
I think the question was asked innocently, or it was asked by somebody who's got people telling them that your diet has to really change because sugar feeds cancer. You know, you've heard that one before. Or you need a supplement, we talk about turmeric and all that stuff, or you need to eat more broccoli because it's an antioxidant and it'll help you fight cancer. But when you actually are having your cancer being treated, or after treatment and you're in what we call the survivorship position, which we've talked about here frequently, about sexual function and exercise and stuff. So what they're really talking about, what the truth of the matter is, I guess, is one, sugar doesn't feed cancer, and no, eating more broccoli isn't going to fight off your cancer. But the whole concept of energy balance in cancer is extremely important. Now, I stood up here a couple of weeks ago on a soapbox, if you'll remember, talking about exercise as a preventative and as an adjunct to the preventative for malignancy, which is proven to be, and an adjunct to survival and to the quality of life in the survivorship or post-treatment period. So if you go to the top, you don't even need your glasses. You can read this in big print. Energy balance in cancer. Okay,
right.
So the whole thing they're talking about here is that energy balance is really important. So that's three pieces, right? Josh and I were just discussing it. Physical activity is part of energy balance. Your diet is part of energy balance, and the weight that you begin
collectively.
They're collectively. Let's talk about the whole piece here. So, Josh, you can throw up that first thing there. Now, I don't expect anybody to read it, but I'm going to read you want to read it? Because this has got some of those bad words. You don't want to read this.
I don't want to read it.
Okay. The effects of low-fat, high-fiber diet and exercise program on breast cancer risk factors in vivo and tumor cell growth and apoptosis in vitro. So you glad I read that last word?
Yes.
Okay, so this is just an example of what scientific articles you'll find in the cancer journals every week. What it really talks about is what this whole concept, apoptosis means the death of a cell. Tumor cell growth means the growth of a cell. So this question was asked about, and let's read exactly how it was asked. Directly affect my tumor's growth. So direct effect would be apoptosis, killing it, or having it grow greater. So the diet actually, during the treatment of cancer, will have no measurable effect on the cancer cell during a period of chemo or radiation therapy. So now you're going to go to that next one there, the colon rectal cancer here. So now we're going to talk about risk factors, modifiable risk factors. Here is where the diet can have an effect on the causation of growth of a malignancy. So this says colorectal cancer, modifiable risk factors. You don't need to read everything, but it's red meat, processed meat, grilling and cooking. You remember we used to say that in Japan there was a lot more gastric cancer because they cooked their food on hibachis, and then you read, well, if you get a steak and you grill it, it gets too grilled, then that makes you have more colon cancer. And then the bottom is vegetables and fruits. You can just leave that up there, and I'm going to tell you an interesting story. One of the most famous malignancies that exists is called Burkitt's lymphoma. And this Dr. Burkitt was an Englishman who went to Africa in a period after World War II, and for a budget of about $200, mostly in stamps, pencils, and paper that he wrote down notes on, a couple $100, he identified an altitude in Africa that's associated with a high incidence of a malignancy called Burkitt's lymphoma. Just think about Hodgkin's disease. And that altitude happened to be the altitude where a certain mosquito lived that transmitted a viral infection to the natives that lived there that precipitated the lymphoma. So he became famous making the observation that if you lived at an altitude that didn't have that mosquito, you didn't get the lymphoma. It was sort of the first epidemiologic observation of cancer causation. He becomes more famous because he noted, and I don't want to get too graphic here, but he noted that the African native has an average bowel movement weight per day of about 1/2 to 3/4 of a kilogram. That's 1 to 1.5 pounds of bowel movement. because they ate, now this is in the 30s, 40s, and 50s, a diet that was very high in what do they call that? Yams, roots, tubers, high in fiber. And that Western Europeans, he's an Englishman, but more so Americans who eat low fiber diets may not have but say 3 bowel movements in a week, and those generally when they have them are formed like that and weigh 100 grams. So it would take 15 of those to equal 1 day's colon output of a native African. He was then able to link that observation to the fact that they have much lower incidences of colon cancer, much lower incidences of high blood pressure and heart disease than Western Europeans and Americans. Now, I've told you about this before, so let's just make the link that my wife is right. There's something in that can that will cause me to get cancer, or that the organic food purveyors are right, and that the wax on the apples that you buy in the grocery store may cause cancer, and if you get an organic apple that didn't have pesticides and doesn't have wax on it, it won't cause cancer. So if we're eating the diet, American diet, where that stuff out of here or that wax on that apple sits in our colon for 24 hours before being evacuated by a stool, and it's harmful, that it will cause more damage than if you were an African and you have 6 or 8 of these stools a day and you pass a pound and a half a stool. It's in lower concentration. It's there for a shorter period of time. Now, that's kind of complicated, but does it make sense?
Yes.
You sure?
Yes.
All right, so we're back to the question again.
Just no test.
Does diet affect tumor growth while trying to fight cancer? Okay, so yeah, you got that pick one. Let's go to this next one here. That big. All right, so we're just talking about fiber, right? Now we're getting you back to selling over there. What's that say?
Whole grains.
Whole grains, okay. Now, the average American eats 15 grams of fiber per day or less. The recommended amount is 35 grams of fiber per day or more, and that African eats 50 to 100 grams of fiber per day. So this is just telling you that plain popcorn and oatmeal and brown rice has fiber on it. But I always tell people that if you eat cereal, Fiber One cereal has 15 grams of fiber in one bowl and only 70 calories, and All Bran Plus has 14 grams of fiber in a bowl and only 70 calories. You get a lot more fiber per calorie than you get by eating popcorn or oatmeal. And so if you're trying to improve your chances of getting cancer, I'm going to come to another one in just a minute, then eat yourself a bowl of Fiber One in the morning and put a bunch of fruit on it, and then you get your fiber up, and that then can decrease the amount of cancer-causing material that sits in your colon. We're talking about colon cancer alone. Got that one?
Right.
All right. Now here.
Because I like oatmeal. No, I like oatmeal and popcorn.
Good. Well, that's good. So you're on the ball
now. I eat oatmeal and popcorn.
Two other things that and I'm going to go back for colon cancer. We'll stick with
popcorn for breakfast, oatmeal for lunch.
We're sticking with colon cancer again. We've already said that exercise lowers the incidence of colon cancer. So now we say increasing the amount of fiber lowers the incidence of colon cancer. I've always told you that by the time you get to be 40, unless there's allergy to aspirin, it causes you to have asthma, or you have gastric bleeding, or you've had an ulcer, everybody ought to be taking at least a baby aspirin and an adult aspirin because of your heart. Well, an aspirin a day lowers your chances of getting colon polyps, I've mentioned before, by about 20%, and lowers your chances of getting colorectal cancer by somewhere between 17 and 25%. So just focusing on colon cancer and answering that question, increasing your fiber in your diet, taking the aspirin, exercising, and modifying your weight all would attack colorectal cancer. Now you can just change the label. It does exactly the same thing for breast cancer and prostate cancer, but the analogies are easier with colorectal cancer when you think about that concentration of cancer-causing materials sitting in your colon between one bowel movement and the next, and you have 48 hours or 24 hours there, where that African has 6 hours there. Is that enough?
Yes, it is.
Did I bore you?
No, you did not.
All right, Josh. Okay.
No, you did not. I picked up a lot on that one. We want to thank the Georgia Cancer Research Center affiliated with Northside Hospital for this segment. And our second question of the day this morning is, what causes, okay, let me get this, what causes a child to sleepwalk or set up and talk during their sleep? It is not an every night thing, but the nights it does happen, it happens multiple times before he rests thoroughly. And I'm going to say this, I mean, I remember I used to think it was humorous when their children were little and go in the room and they'd be talking, in their sleep. I used to think that was humorous, and both of my kids talked in their sleep when they were little, and one slept with their eyes open. I'm probably in big trouble, and that was always scary to me.
Did you think that was normal behavior, average behavior, or very unusual behavior?
I thought it was normal.
Great, you're right.
You're
right. Okay.
First
of all, I'm not going to make you do it, but put up that chart there, Josh.
Now, I don't know about the sleepwalk and the sitting up.
I'm getting there in a minute. I'm getting there in a minute. Okay, Josh has got a chart up. I'm not going to make you read it, but this says, overview of parasomnias. That's why I'm not going to make you read it.
I can handle parasomnias.
Okay, and sleep-related movement disorders in children.
Okay.
All right. And we're going to stick to the left-hand side pretty much. The first one is disorders of arousal from non-REM sleep. And you'll find everything they're talking about here. Confusional arousers, sleepwalking, and sleep terrors.
Right.
If you switch over to the ones that are parasomnias associated with REM sleep, that's non-REM sleep, then you get nightmares, you get nighttime urination in the bed when kids wet the bed in their sleep. Now, people think, oh my God, but kid's asleep. How does he? That is a normal behavior in a certain percentage of patients. And then there's what's called sleep paralysis, where you can't move. And then there's sleep behavior disorders. And there's lots and lots and lots more as you go across here. Now, this is the interesting thing. I got two studies for you. First of all, this occurs in young children, and it generally is totally outgrown by the time they become adolescents. Second is risk factors. There's a familial link. If you take twins, identical twins, versus fraternal twins, if it occurs in one identical twin, it tends to occur in the second twin more than if it occurs in one fraternal twin to the other fraternal twin, but it's actually higher in the second fraternal twin than it is in kids in the same school. In other words, it runs in families, but it's even more common in kids that have the same genetics. Is that making sense to you?
Yes.
Now, if your father was a sleepwalker and your uncle was a sleepwalker and your grandfather and your great uncles were sleepwalkers, what's the chances you're going to be a sleepwalker? A lot more than the guy who has no sleepwalking in his family. Now, I want everybody to listen to this. Sometimes we go blow smoke here. We're not blowing any smoke. Young children aged 2.5 to 6 years in a large study, parasomnias were ubiquitous. 88% of normal kids manifest at least one parasomnia during a period of 5 years of observation. Now, 88%, Josh, is that pretty close to 100? So that your kids were having normal behavior. Now, your sleep terrors or night terrors were the greatest. That was 40%. Sleepwalking, where they actually get up and walk around,
Right.
15%. Nighttime sleep urinations, where parents just go, oh my God, I had to change the bed. I mean, as a kid, 1 out of 4 kids did that. 25%. Now, I got one for you, Josh. What's bruxism? Grinding of the teeth. All right, teeth grinding was 46%, so that's the highest. And then rhythmic movement disorder. You remember last week we had a question about what happens when you're asleep and your arms do this?
Yeah.
Remember that one?
Yeah.
Yeah. Rhythmic sleep disorder, 9%. So close to 10% of normal kids between the ages of 2.5 years and 6 years will have one of these things happen to them if they live in Quebec, Canada. No, that's where the study was done. So basically, what causes this is it's normal. Should you panic? And the answer is no. Generally, except for sleepwalking, they're gone by the time kids are 7 or 8. Sleepwalking can persist into adulthood, as you know, but generally by the time they're in early adolescence, say 11, 12, 13, or senior high, all of those behaviors will be gone.
Okay,
is that reassuring?
Yeah, but that you said that, and you kind of answered the second part of that question I was going to have. Outside of the wetting the bed, how many of those things can carry on through adulthood? Which are the most?
None of them.
None of them.
No, basically, well, let's say sleepwalking might, but
because I know adults that sleep still, and I hear stories that they get a bite thing because they grind their teeth.
Yes, but that's a different.
Is that different? Is that not something they're carrying over from childhood?
No,
that's something you develop later.
You develop later. Yeah.
Okay.
That's a good question though. And interestingly enough, the reason that parents are so upset, particularly for kids and does like that, is that if you look in here, it says these are complex behaviors. They include restless legs and everything else, and parents think that the children may have epilepsy and that they're having epileptic spells in the nighttime. Now, when we talk about grown-ups with restless legs, it's so common that when you're, say, 50 to 60 and your feet are doing that in the nighttime, your wife doesn't think you develop an epilepsy. She knows enough about restless legs to say you get restless leg syndrome. But when you see your 3-year-old doing that in the bed at night, I mean, it scares the heck out of a parent.
I can understand
particularly if it's a first child.
Yeah.
And you think, my gosh, my kid's got epilepsy when he fell out of the bed a few months ago. He had a head injury or something. So I really want to reassure this mother. Where was that thing here? I'm going to just go back to that question. What can cause a child to sleepwalk? Okay, that was or sit up and talk. That's the second category there. During their sleep. Well, first of all, what causes it is normal. It's not something bad in the brain. You might say it's caused because you had it, or your husband had it, or your mother had it, your grandmother had it. But so it tends to be familial, and the causation is it's a part of normal childhood, and it'll generally be gone away by the time they get in school. And if it's sleepwalking, it should be gone away by the time they get in middle school or in high school. And he says it doesn't happen often, but when it does, it happens multiple times in the same night, and that's basically true.
You know, one of the things I think I gotta back away from the word wrong, because that's the wrong word in this situation. I don't know where this brain just went.
Incorrect word.
Incorrect.
Yes,
so I'm going to back away from the word wrong, but I think one of the things with kids today is they don't know anything about playing in the sandbox and eating dirt unbeknownst to their parents.
Correct.
You know, and I mean, unless you went out and made mud pies, and if you're 5 years old, I'm sorry, and the little girl, 4 years old, the only reason you let her in the sandbox is she knew how to make mud pies, and convince you to eat one of the mud pies. I mean, you're not living. I don't know. Did I just go off the rails?
No, you didn't. You remember we were talking about allergies and hand washing and all of that quite some time ago. And there's been a recent increase in the publicity that children need to be children. So they need to be exposed to dogs, exposed to cats, exposed to dirt on the ground, exposed to the playground, so that they get all of the normal immunologic stimuli between the time they can start learning to crawl and the time they enter school, so that they don't go in there like they've been in one of those life bubbles, you know, and not exposed to everything, or when they get to school, get around other kids, they're going to be sick all the time. So eating dirt in the sandbox and falling down and scraping your knee and having a Band-Aid on your knee and falling down and hurting your elbow and digging in the dirt's normal. I mean, kids ought to do that again.
I'll tell you what, I'm going to save for next week in the effort of time my hand washing story. So remember, I've got a hand washing story, and I've got a popcorn. You got to remind me next week.
Popcorn hand washing.
Popcorn, and you got to ask me what a popcorn pillow is. All right, next week, and then I got to tell you a hand washing story. Thank you to Georgia Cancer. Thank you to there went my screen.
I don't care. Thank you to Georgia Cancer Specialists affiliated with the Northside Cancer Comprehensive. Whatever we are.
I have Georgia. Thank you, Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. And Dr. Whaley, I know you are ready to give us a 2019 first one of the year, something new that's happening in medicine or out there going on. So now, I know you're ready for this.
Last time we were here, which was 2 weeks ago, I pulled up the list of medical issues, and the number one was exercise. Then there was something else.
Oh,
and then
I remember.
Was exercise again, right?
Yeah. You emailed it to me.
I also had it here, though.
Yeah, I know.
I emailed it to you. I sent it to your wife.
Oh, I know.
I had it put on it was stuck to your windshield.
Move along.
We were talking here a few weeks ago, when we got into talking about vaping, actually. We're talking about the damages of the cell phone, kids having them at night and texting in the nighttime and getting poor sleep. This happens to be the exact list of the articles as they came out yesterday, about 150 of them. The first one, you can read that. Was it print too small? Good sleep helps kids become slimmer teens. Good sleep helps kids become slimmer teens. 2,500 kids, 20 U.S. cities, talking about what they do in the nighttime, go to bed, get 8.5 to 10 hours of sleep, not play on the cell phone.
You do not need a glowing computer screen across the room.
You do not, and you don't.
You
need
do not need that cell phone glowing.
No, you take the cell phone away.
Right, exactly.
You take it away when you get home from school, and you give it back to them after supper, and take it away an hour later to give it back after breakfast in the morning. Okay, now you've only got to go down one more, skip one, and then you get. This is a big title. We've been doing this for weeks. Opioid overdose triple among kids and teens. They're linking some of that opioid use back up to the poor sleep habit. Remember what I said about drinking the energy drink to get energy to go to school? And some of that opioid use to the pressures of the social networking when they're in the middle of the night, and I've even done what they call it, tweet, or whatever it is.
Twitter.
Anyway, when they're tweeting,
Instagram.
Whatever they're doing at night is putting stress on those kids. They're
Snapchatting.
And then they go, I don't know about Snapchat, but
they
then they
do everything.
They go and they drink an energy drink. It makes them easier for them to go vape, and then they're dying of opioid overdoses, and that's all one big package, and I'm off my soapbox with it.
You know, I want to say this before we go. Well, thank you so much. You have been so helpful to this audience. I really want to be serious for a minute. You've been so helpful to this audience and the segments and the people that go back throughout the week and pull these different segments up and watch them. You've been personally helpful to me. I will tell you, I have done my own sleep study no, this is not a joke. You have talked to us here with me present about sleep.
Yeah.
I make sure this is off. I don't have it glowing. I make sure the room
is it in another room?
Huh?
Is it in another room?
No, it is my alarm clock.
All right, go ahead.
Well, I mean, that's how we have alarm clocks now. All right. So I make sure, but I have changed. There's no TV in the room. There's a lot of things that have changed that I made. now I'm over my fear of sleeping in the dark now because, no, that's my joke. Okay. But seriously, I've changed so much, and I have noticed a difference in my sleep because I actually identify that area with a place where and that all came from you encouraging me to do that, and those out there.
All right.
Yeah.
A lot of other people in this special expert panel think I'm crazy.
I don't know who that would be.
Including Mr. Gluckert.
Hands are going up. Whoa. Dr. Whaley, thank you very much. What a great way to start 2019 with Ask the Doc at Georgia Cancer Research Center.
Remember, we have 3 congressmen now who've been at the tip of the spear and have lost a leg, an eye, or an arm, and are combat veterans in the new Congress. I don't even know whether Republicans or Democrats, but
they're there.
I hope they're there. They're there, and it makes me happy.
There's a Georgia Cancer Research Center affiliated with Northside Hospital. If you want a question, if you want to get a question to Dr. Whaley, you send it to info, I-N-F-O, at fetchyournews.com. Put in the subject matter there, the line there, ask the doc, and we will get it over to Dr. Whaley. We send him the questions hopefully every midweek so he can prepare for the show, and as you can see, he goes through them very thoroughly. You'll get a great answer, and if we can't get to your question, he will respond. Okay, so send them to us, info at fetchyournews.com. Ask the doc. Thank you very much for this 2019 great opening to this segment. We have another great opening 2019 segment right after these commercials. The All-Star Political Panel. We have the 2 lovely ladies and Rick. That's who they are. The and Rick. We have the 2 lovely ladies and Rick. We'll be right here, and we've got a lot to talk about. Take us a break, Josh.